Ow, that hurts. Have you ever experienced pain on the outside of your elbow when climbing? Well, this video is going to talk about the reasons why you experience that pain and ways that you can actually help to improve, build up strength, and climb better. Hi, my name is James. I'm a physical therapist in Chicago with Lee Physical Therapy. Today we are going to be talking about lateral epicondylgia, lateral epicondylitis. Sometimes it's referred to as tennis elbow. Why we experience that pain during climbing. Tennis elbow, what is it? It's a really common thing that happens when you're actually playing tennis. You're going for a backhand, and when you're, as opposed to just using your whole body, if you're really focused on trying to hit the ball with your wrist and you're flicking your wrist a lot, those wrist extensors will pull on the bone here. And if you're not used to that motion, you can put a lot of stress to that area, and this area turns into a hot spot. It's also really common if you're doing a project at home, a DIY, right? And you have to either hammer something or you're using a screwdriver. All those actions are also ways that you can put a lot of stress to this lateral elbow region here. Let's first actually dive a little bit into the anatomy of your wrist extensors and how they are connected to the outside of the elbow. Now, where the muscles are connected to, the wrist extensors, at the metacarpals, right, you have these little blue dots right here, 1, 2, and 3. Those are the attachments of the wrist extensors. So what allows you to extend your wrist are these muscles that are attached to your first, your second, and third, as well as your fifth metacarpal. And that tendon will travel, and there's two different connections actually. The first one is connected right at the lateral epicondyle here. That's a muscle called your extensor carpi radialis brevis. But just above the lateral epicondyle, that bony prominent point, just above there is another muscle called your extensor carpi radialis longus. So these two muscles, you got the longus and the brevis, and then all the way over here is the extensor carpi ulnaris. Those three muscles, the extensor carpi ulnaris also comes together and converges into the lateral epicondyle. Now, those three muscles in unison will do two actions actually. One of them is they'll extend the wrist, right? If you isolate the wrist, those three muscles will help to extend. But at the level of the elbow, you can actually, when your hand is in a pronated position, you're actually helping to flex the elbow as well. So, typically we think of our elbow flexors as like our bicep muscle, or underneath it is a brachialis muscle. But your wrist extensors also secondarily flex the elbow. Now, how does that relate to climbing? Right? Because a lot of times, unless we are climbing like a big juggy undercling route where like our biceps are just massively engaged, that's not all, most of the time that's not the case. We are in a pronated position, you're grabbing things, and as you're pulling in, right, you can actually even see the muscles like contracting as I'm grabbing onto the wall, and as I pull in, these muscles are secondary elbow flexors. If you're climbing really overhung, juggy routes, and you're a beginner climber, like climbing within 2 to 3 years, the action of grabbing the hold and then pulling in to make that next move is that exact elbow flexion, right? And so as you're pulling in, you're constantly stressing this lateral epicondyle area, right? The lateral epicondyle is the bone, and then it actually connects to something called the common extensor tendon. And then from the common extensor tendon connects the extensor carpi radialis brevis, extensor carpi ulnaris, as well as even some of your finger extensors as well. All these muscles are all connected to that common extensor tendon, which connects to the bone. So as you're climbing, it could, whether it's even a juggy route and you're just constantly trying to pull in, it can also be stressed from pinchy routes too, right? So when you're pinching an object, Because the wrist is a pivot point here, if you're trying to pinch something, we naturally think that the pinch, you have to have very strong like finger flexors as well as wrist flexors. But if you dominate with that, then your wrist is naturally going to flex. So you have to have equally strong wrist extensors while you're pinching that object there, right? And so if you're climbing a pinchy route and you're projecting that over, a span of an hour or two, and you're not used to that, then that's going to put a lot of stress to the lateral epicondyle region here. Another way that you're actually injured this area or like feel that stress is an overhung crimpy route, right? Because once again, similarly to pinches where you have to keep that wrist locked, especially if you're crimping onto something and it's slightly overhung, and as you're pulling in, right, those wrist extensors once again have to engage, and you're putting a lot of stress to this entire area here. What are ways to help rehab it? You definitely want to find exercises that can help to actually desensitize this area. A lot of times the issue is just your body, your brain is just so hyper-focused on this area that everything is just really sensitive. It can even be sensitive to touch, like the example of grabbing a cup or turning a doorknob. Like all those different actions puts the actions of these wrist extensors, and that's going to put that stress there. There are several different exercises that you can actually help to rehab your wrist extensors. You can go very light, simply even using, this may even be too much weight, but you can even use like a foam yoga block. And essentially you want to rest your arm here and then work on just holding this action here up and down. And then you can, as you do that, you want to actually hold it there for about 5 seconds, relax, and do 10 reps like that. And that's going to help to engage all these wrist extensors, which is essentially pulling on that area where it's a hot spot for you. And as you continue to do that on a daily basis, that'll help to reduce some of that hypersensitivity, build up the strength, and help to rehab it as well. Now, another exercise, just as I was saying earlier that the wrist extensors have two different action points, right? It extends your wrist, but also flexing the elbow. Then you want to incorporate something where your wrist is locked out, but you're actually incorporating some elbow flexion exercises. So a great way to do that is to either use something as simple as a dumbbell, right? Holding the dumbbell in that pronated position and then repping out 10 to 20 reps of a fairly challenging weight, but something where you can complete those 10 and 20 reps, 2-3 sets, and try to do that as a warm-up before climbing. Another way to do it is grabbing the easy curl bar, which is like a zigzag bar, right? Where your hands are locked in place. And you want to grab the bar where your hands are slightly in that pronated position here at this angle. And then you're just reverse curling, right? That way you can help to use a lot more of those secondary elbow flexors. Again, 10 to 20 reps, somewhat of a challenging resistance, 2 to 3 sets, and do that as a warm-up before climbing. One other exercise I think would be really helpful is where you can actually work on engaging those wrist extensors, but at the same time trying to work on a little extension here. So what a great way to do that is using a cable machine, handlebar, and then setting the height of the cable a little bit higher up on you, and then just working on extension like that. That way you're gonna also be engaging your triceps as opposed to biceps brachialis, but working just a different action, as well as you're still engaging those wrist extensors in a different way. And then once again, 10, 20 reps, 2 to 3 sets, and use that as a warm-up before climbing. So these exercises are helpful when you have that lateral epicondyle pain. You can start off with going very light initially, especially when you're experiencing the pain. I would just get the repetition in, and just focus on the single arm. Whereas, couple months down the road, this is also a great way of using these exercises as a way to start building up strength in both arms as well. So, it's a little bit of a blurry line between rehab versus strength training exercises. I think there's a little bit of a combination of both. But start off with very light to begin with, and then as you continue to get stronger, you want to progressively increase the load so that you can make it more challenging, and then your tissue definitely needs that stress. If you're just consistent with one type of weight over a span of 6 to 8 weeks, not as helpful as continuing to progressively load the weight so that you're making it a little bit harder each time. All right, thanks so much for watching. So today, in summary, we talked about lateral elbow pain or tennis elbow. And this happens a lot when you're climbing overhung routes where you're having to lock the wrist in and you have to pull in there. Now, those exercises, you want to start off very lightly initially to just get the motion going, get the stimulus, stimulating this area so that you can work it out. And over a period of time, progressively load it, make it a little heavier every week so that your body can actually adapt to those different levels of stress. It's a great rehab exercise, but also once your elbow issue is recovered, it's also another great exercise to do just as a supplemental to help getting stronger in climbing. Thanks so much for watching. Be sure to like and subscribe, and I'll see you next time.